Saturday afternoon, everyone. My name is Jerry, and thank you for tuning into my channel, Carnivore Jerry, in the middle of the forest. Here's a brief introduction as to why I started my YouTube channel. I started my YouTube channel primarily because my husband and I both retired from our respective professions. He, a lifelong business owner and truck driver, family business, and myself, a retired realtor and business owner, retiring from the big city of Milwaukee, Wisconsin, to move up north in Wisconsin, where my husband was vacationing as a small boy all his life up in the Blue Diamond area, otherwise known as Sampson, Wisconsin. Sampson, Wisconsin, however, does not have a post office, and our nearest post office is considered New Auburn, and New Auburn is approximately 40 miles north of Eau Claire, Wisconsin. We live on a lake in the middle of a forest, and progressively my channel had changed from just being retired people in the middle of a forest to me going back to work, because I ballooned up to 363 pounds. Of course, subsequently, so did my husband. He gained weight. I had found, long story, but by the grace of God, I had found a diet, way of eating, I like to refer to it as, that suits me very well. And that is the carnivore diet. Hence the channel name, Carnivore Jerry, in the middle of the forest. Is this channel going to change its name? I don't know. I do have a secondary channel, and that channel is called 1234 Let's Go. I started it because of doing budget ideas. And to be frank, 1234 is $12.34. That is what I had decided, or I know, not decided, that I spend out of pocket as an average in the course of my day while living in the middle of the forest up north in Wisconsin. $12.34. So that channel is primarily geared to budget. I have not been on it very much because, well, life gets in the way, which leads me to today. If you've been following along, you have seen that both Jack and I have had some medical ups and downs. Mine has not been related to my way of eating. And I am extremely grateful for this way of eating, because as I was 363 pounds, a size 4XL tall, because as my mother would say, girls are never 6 feet tall. So I used to always tell people that I was 5 feet 12. My height has shrunk a little bit last year, almost to the date. Well, it was actually April 19th that I had my back surgery, spine surgery, to rectify and remedy, and subsequently, while doing my physical therapy doctor, person treating me, said, "You're not progressing the way you should. I think we need to look into your hip." Hence, now May 1st is my surgery day for a brand new hip. So there you have it. I am driving presently to pick up my husband So if you watched yesterday's video, and if you haven't, I certainly would like you to check it out. It may be in the cards. It may be at the end of this video. So check it out. I had to drive my husband. He woke up in excruciating pain, throwing up pain on his right side, underneath his breastbone. Earlier in my career, before becoming a realtor, was an EMT. Owned a business. I owned a business of ambulance company, handicapped and elderly transport. Yeah, I did a lot of stuff. So as we're driving to Mayo Clinic, well, first and foremost, you have to understand, if you know Jack, and if you're his children or any of his friends watching this video, you know that my husband waits till the very last minute to go and get any type of medical history. He's a tough cookie. Or medical help, I should say. And yesterday it was one of those days that I had to put my foot down and say, you've been having this pain since 6 a.m. It was at the time almost 9, or a little bit after 9. And I insisted that we go to Mayo. Now, we do have a Mayo Hospital in Bloomer, Wisconsin. However, as I mentioned yesterday, usually, if something like this case that happened yesterday were a dire situation, they would have had to take Jack via ambulance, or if he would be having a heart attack, and he has had a heart attack where Mayo 1 would come, the helicopter, and pick him up and take him into Eau Claire. That's happened for Jack, not once, but twice. Do you see what I mean? My husband's lived on the edge all of his life. He had an appendix burst before I met him, a couple of years before. Drove from Minneapolis to Milwaukee, stayed home for a day before he went to the emergency room. Almost died that time. I didn't know him in the 70s when he was hit from behind by a drunk driver. This is the extremely condensed version of the story. Hit by a drunk driver. His legs were imprinted into his bumper. It was a hit that bad. Rich kid, Chicago, driving daddy's big iron, at the time those were big iron vehicles, and smashed Jack in the back in his El Camino. Hence, his legs were dangling. Yep, that was my husband. At that point in time, again in the 70s, he was taken and they had to do major reconstructive surgery. The doctors at the time actually wanted his legs to be cut off. It was that bad. Jack insisted he wanted to have stinky feet for his life, and that was in the 70s. Roll the clock. Heart attack my husband had. Waited maybe, in my opinion, 5 days too long. Had a heart attack. He insisted we go to his mother's house at the time, cut the grass, and do an open house because the house was for sale after she passed away. Went back to Milwaukee, still waited a couple of days, and then decided, I need to go to the emergency room. Went to St. Luke's. Yep, had a massive heart attack, and the doctor said if you would have waited until tonight before you came in, you, sir, Mr. Griggs, would have been dead. That's my husband, living on the edge. Jack's going yesterday to Mayo Hospital via my insistence could have been one of those death situations if he waited any longer. The gallbladder, those of you that know it, have experienced it, don't have a gallbladder, or have had gallbladder stones, etc., etc. His gallbladder was so huge and it was so full of stones that when the surgeon went to cut to remove it, it was the size of the surgeon's fist. And I'm a lady, big-handed because I am a tall girl. He said that they had to drain fluids and do measures, hence the waiting for 2 hours because of the surgery, but I didn't know it. I was in the waiting room. And he, the doctor, the surgeon, divulged that to Jack, that it was a very scary surgery. I was concerned that nothing was nicked. How was his liver, etc., etc. That's all fine. He doesn't have much stuff in him anymore, guys. No appendix, now no gallbladder. He's got a liver, he's got a stomach, and now it's my turn to be extremely insistent. Zero processed food will my husband be ingesting. Doctor agreed with me. I'm going to have to put my foot down and insist that, sorry, Jack, those processing days are long gone. Obviously, we're going to have to watch his fat consumption and be very careful now, as it's very new. He told me this morning by our telephone conversation that they were waiting for him to have more pronounced audible belly sounds, stomach sounds, intestine sounds, use whatever verbiage you wish to use. Bottom line is they needed him to pass gas. So they know that that's all working. That's huge. The Mayo Clinic here in Eau Claire is hurting for certain. If you're a healthcare professional, doctor, nurse, whatever the case may be, if you know a doctor or a nurse that wants a job in Wisconsin, they are looking for help so bad. I, by the grace of God, am so grateful that they found a room for him yesterday. They made a room for him yesterday to put him in. Otherwise, he would have been waiting in the surgical suite until now, me picking him up to bring him home. They are so loaded to capacity with the patient rooms, it isn't funny. There were two hospitals in Eau Claire that have shut down, St. Joe's and Sacred Heart. Two major hitters in Eau Claire hospitals because they're down. Mayo Clinic in Eau Claire is extremely overwhelmed. Not only are they overwhelmed insofar as getting patients in their rooms, etc., they really need doctors, nurses, scrub techs, housekeeping people, you name it, to fill the gaps for the other two hospitals and take care of the patient needs. Mayo Clinic's motto is the patient comes first. So yes, Mayo Clinic is not up to the caliber of what I am looking for in a physician. They do not practice the ketogenic way of eating about diet. They like balanced diet, fruits, grains, a whole diet, if you will. Not that there's anything wrong with it, because remember I said I don't yuck somebody else's yum. However, for myself, my whole diet will consist of no packaging, yes, whole foods, and give me that pickle. Every once in a while, I will buy a processed jar of Grillo's pickles, or if they don't have Grillo's, brand that I have known and trust all of my life, the Milwaukee brand pickle. So there you go. I'm about to get off at the exit. Thank you very much for driving with me. More to come as I pick up Jack. Thanks for driving with me, and we will talk later. Cheers for now.
Now here are the current prices at Quick Trip for gasoline. Let me go and do the E85 pump and show you what that currently is. This is the gas price right now of E85 ethanol, $2.28 a gallon. That's E85. These are the current prices of unleaded, $2.89, unleaded E88, and the premium unleaded of $3.89. And right now I have $2.40 worth of pump points. So let's fill this baby up. 28.5 gallons went into the gas tank. Now it's time to fill up the can I brought along. $14.07 for 30 gallons. Yeah, I'll take it. Thank you, Quick Trip.
Well, ladies and gentlemen, here's Jack. I picked him up from the hospital and now we're heading home. How are you feeling, honey?
A lot better than yesterday. I was hurting big time yesterday. Surgeons took out some organs and I feel pretty damn good. A little sore, a little tender, but the surgeon told me your gallbladder is supposed to be the size of your thumb, and mine was bigger than his fist, and he had to drain fluid out to make it small enough to pull it out through the incision by my belly button. So he said it's been going on for years, and I never was aware. I never had a health issue. And all the surgeries and CAT scans and MRIs I've had, nobody's seen it. So did somebody drop the ball? I don't know. But he said it's been going on for years and years. This is nothing new. So, well, it's out now. We don't ever have to worry about that. So, happy days.
Thank the Lord. Thank goodness. There's a bit of construction going on here in downtown Eau Claire. Last night it was crazy busy with whatever convention or something is going on. So we're taking a detour right now. How's your stomach feel? Your incision feel?
The right side's a little tender. Total of 3 incisions. 1 to pull the gallbladder out, 2 for cameras. And one of the ones on the right side where my gallbladder was. That one's a little tender. I don't know what all they cut in the inside, vessels,
Muscles.
Yeah, I don't know, but he said it was pretty good surgery. But he said I was surprised how large it was. He said you're a lucky boy. That's what he told me.
Yeah, I'm glad we got you in. Finally, one time in your life, you listened to me about going in for seeking medical attention, which I'm grateful for. Thank the Lord.
Yeah, you were right this time.
Yeah, we didn't have to wait days like you did with your heart attack. I was explaining on the way there how many days you waited with the heart attack and how long it took you with the appendix before I knew you, of course.
Well, I'm still here, so my way wasn't wrong.
No, that's called God.
Well, he might disagree.
God's taking care of you.
All right. See?
That's the bottom line.
here we are. Happy days talking, doing videos.
Gotta have some faith. A whole lot of faith.
Yep.
All right, we are done with the construction. We're going home. Until we meet again, folks. Cheers for now.